these tests are useful for asymptomatic adults who might have hidden cardiovascular risk. They may have no symptoms at all, just risk factors. And these individuals probably wouldn't be flagged by conventional screening tests, including the Framingham risk score, which can tend to underestimate risk, particularly in younger individuals. So when I think of patients where it may be useful, I think of patients who are typically over the age of about 40 years, who have some cardiovascular risk factors like hypertension or prediabetes or a sedentary lifestyle, poor diet, who have not yet demonstrated any evidence of cardiovascular disease, but they're at high risk down the road, or maybe at elevated risk down the road for future events. And there are some other populations who have increased risk, like the South Asian population in particular. Some groups who have systemic inflammation, patients with rheumatoid arthritis, long COVID, have significantly elevated cardiovascular risk. There's one other group that may benefit from this test, and it's the patients who've been receiving therapy for cancer with cardiotoxic medications or immunotherapy. And this test can be an index of low-grade cardiac damage long before anything else becomes evident. Another group that's receiving a lot of attention lately is the endurance athlete group. In this group of patients or individuals, it can be important to distinguish between just overtraining or some underlying cardiovascular condition that may put them at risk, particularly during an acute event or during long training sessions as well. So it's important to clarify that this is not a test just to use in isolation. It's best used in the context of an individual patient's risk, along with other factors, sometimes imaging as well, to help determine the best approach to long-term management. Now, in these populations, some of these individuals won't have cardiovascular disease and others will. So it is important to determine who would benefit most from preventive strategies. We don't want to start patients on medications if they're unlikely to benefit. But conversely, if somebody's at high risk, we want to really optimize all their risk factors and their potential therapies before the problems become much more real and sometimes out of control. In terms of frequency, this test could be considered annually in individuals in the intermediate risk group. And if the result is elevated, then depending on the underlying cause, repeat testing in 3 to 6 months may be indicated as well. And it's a very practical, evidence-based way to move toward more personalized cardiovascular care.